I would like to move on to next presentation about a very controversial topic, which is neuroprotection. Is it a mirage? We have Dr. Kavitha for and Dr. Vinita against it.
Good afternoon, everyone. Thanks for the opportunity. So, neuroprotection, Mirage. So, as we all know, glaucoma is an optic neuropathy, basically a neurodegenerative disease characterized by loss of retinal ganglion cells. And glaucoma is viewed as a disease of intraocular pressure. So, we always equate glaucoma is equal to intraocular pressure. But we all agree with the fact that intraocular pressure is only one of the risk factors. And recent evidence indicates that lowering intraocular pressure does not prevent progression in all the patients, and we have factors beyond the intraocular pressure. So hence this strategy came of treating the disease by preventing neuronal death. So there are a lot of pathways which leads to the neuronal death, apoptosis, and the loss of retinal ganglion cells. There can be neurotrophin signaling, genetic factors. Ultimately, what we land up is apoptosis and loss of RGCs. So this is a very big, attractive list. I know my opponent is going to show this. It looks very, very attractive. Big number of medications, oral preparations, topical, everything. But the sad fact is, except for anti-glaucoma medications, everything else is still in the experimental stage. When I was in college, it was an experimental stage. I have completed my PG. Now I have completed 12 years of a consultantship, but still it is in experimental stage. So even if you take anti-glaucoma medications, which is shown in the list, IOP reduction is the only factor by which it offers neuroprotection. So what about the other drugs? We have memantine, so it was promising in animal studies, but what happened? In randomized human trials, it was proved to be ineffective. So what about other drugs? So we have calcium channel blockers. We have to weigh the risk and the benefits before we prescribe any drug to the patient. So the ischemic stress causes the reduced perfusion to the optic nerve head, and it again compromises the health of the optic nerve. We have drugs like curcumin, which showed positive response in animal studies, but could not prove the same in the bioavailability in the human trials. So what about stem cell therapies? Yes, lots are coming up. These studies demonstrated successful differentiation of the human embryonic stem cells into RGCs in the host retina. But in which stage it is? This is still in the experimental stage, and nothing has come to clinical practice. Just to conclude, there has been increasing interest in neuroprotective therapies for glaucoma, but definitely it faces several challenges. So whatever trials we have, we don't have head-to-head comparison of the conventional treatment and the neuroprotective therapies to prove, to demonstrate the benefits of neuroprotection. And the sad fact is, IOP lowering using the anti-glaucoma medications is remaining the first line in the management of glaucoma. And there are a lot of ethical and scientific challenges to develop novel drugs for neuroprotection. I know how hard it will be for Dr. Vinita. It is really, really hard. And I think the day is not far. Though it looks like a mirage now, I hope we definitely will land up in a day when not only me, all of you will be standing with Dr. Vinita. So we will have drugs not only to treat glaucoma using neuroprotection, but to prevent glaucoma. Thank you.
Thank you, Dr. Kavitha.